5. Reasons for depression. Depression is a complex mental health condition that affects millions worldwide. Understanding its underlying causes can help in addressing and managing the disorder. Here are 5 common reasons for depression. Genetic factors. A family history of depression can increase the likelihood of experiencing the condition. Genetic predisposition plays a significant role, suggesting that depression can run in families. Biochemical imbalances. Neurotransmitters such as serotonin and dopamine regulate mood and emotions. An imbalance in these chemicals can contribute to feelings of sadness and hopelessness, making it difficult for individuals to cope with daily life. Life events. Traumatic or stressful life events, such as the loss of a loved one, divorce, or financial problems, can trigger depression. These experiences can overwhelm emotional resilience, leading to persistent feelings of despair. Chronic illness. Physical health issues, such as chronic pain or serious medical conditions, can also lead to depression. The ongoing struggle with health can create feelings of helplessness and isolation. Social isolation. A lack of social support and meaningful connections can exacerbate feelings of loneliness. Isolation can create a vicious cycle where the absence of relationships contributes to depression, which further alienates individuals. Understanding these factors is crucial for seeking help and developing effective treatment strategies. Recognizing the interplay of biological, psychological, and social elements can pave the way for recovery and better mental health.